HRT is like, why are we sitting even and doing this talk today? As we know, every woman goes through menopause and it's a transition, isn't it? There are stages like perimenopause, menopause, postmenopause. And as you said rightly, during these times, hormones, estrogen, progesterone level fluctuate and eventually decline. And the hormonal shift, what drives you to symptoms. Some people get hot flushes, mood disturbances, sleep, vaginal changes, which can significantly impact your quality of life. And that's a key point because these symptoms are driven due to the hormonal changes. So naturally, one of the most effective way to manage them is by addressing these hormone changes directly. When I say that, that's where the HRT comes in. Simply replaces hormones that are declining. What do these hormones are? They're usually estrogen, but if the woman has a womb, then we also add progesterone because we need something to protect the lining of the womb. In some cases, very rarely, we also have to give testosterone, particularly if the woman is really struggling with low libido. Important thing here to remember is HRT is not one single treatment. There are different types, different doses, different ways of taking it, and it's always individualized to every woman. So if suppose your friend comes and tells you that this is helping me, go and ask the doctor there, please don't do that because it's so different from one person to another. So most commonly, I wanted to give to HRT to every single person or at least have a conversation to people who have undergone premature ovarian failure or insufficiency. What do I mean by saying that? Suppose you stopped your period very young, less than 40 years, 35 years, 30 years, 25 years. Definitely have a talk with your doctor without even having symptoms. And primarily, it is not for the symptom control in that age. It plays a key role in protecting long-term health conditions. We are talking about bone health and cardiovascular health and memories. It is HRT mainly used for person who experiences menopausal symptoms. There's a huge list of symptoms that can affect from head to toe, but most commonly is hot flushes, night sweats, poor sleep, anxiety, brain fog. Yeah. Now, the next one is which we often don't talk much, but vaginal and sexual symptoms. Yeah. Some will have lack of libido, vaginal dryness, burning, irritation, and recurrent urinary tract infection. So these are the most common types when people come and talk to us about starting on HRT. When we talk about who can take it, it is really important to also talk about who should be cautious about it. Definitely letting your doctor know all your medical condition before you start talking about HRT. Sometimes we also say that people have to undergo all the specific tests or other causes to rule out any other causes giving you symptoms and blaming everything on HRT. So definitely, as you see on my slide, there are certain conditions which I put it up where we need a little bit more careful consideration, especially migraine with aura. You have a history of blood clots, some heart conditions, high blood pressure which is uncontrolled, or unexplained bleeding, some liver issues, family history of breast cancers as well. But it does not mean you cannot have HRT here. This does mean that simply we are going to look at you as individual person. As I said, one size does not fit all. We might have to take a step back, look again at your health as a whole, and then choose what is safer option for you. It might be your doctor might start you on a very small dose and choose a different preparation from tablets to gel to pessaries or picking the hormones, because even when I talk about estrogen and progesterone, I can't go more deeper into that, but Estrogen are many different types and progesterone also many different types. They are synthetic, they are natural. So the doctor will able to pick the hormone that suits your body better. Once it's started, we have to regularly check you and adjust the doses if needed and to make sure everything continues feels right for you. So the idea is not to avoid HRT out of fear. The aim is to use it safely, carefully, and in a way that works for you. Few conditions where I should be really cautious and possibly not go for it is personal history of breast cancer, especially if it is estrogen dependent cancer, because that will make it go worse. And if you have some pathology or some cancers in the womb and not being treated. As we mentioned about it, you can see over here, I mentioned it about some are transdermal, some are oral, and other vaginal. So when I mean oral is, that is possibly most people are used to it. They take the tablet because it's being given. It comes as a pills, it could be a capsule or a tablet. Currently, transdermal is more going and taking more people are prescribing that because they are more gentler on the body for some women. It comes in a form of patches, sprays, gel. Some are implant as well, but implant is, we don't use it in HRT anymore. It's only gel, sprays, patches, and sometimes we use oil in a part of a HRT. Vaginally, there are creams are there available and pessaries are there as well as rings, E-string rings are available. It is quite good if you only have vaginal symptoms and you get repeated urinary tract infection, vaginal dryness, or lack of libido, or sometimes even pain while having sex. This is really important to use them. Some people wonder whether you can have a systemic HRT along with vaginal HRT. Yes, you can have both at the same time, but your doctor will keep you right. But there's no reason why you cannot have both. So this is what is most important, and that's why we would talk about the HRT. What are the benefits of HRT? So there are some short-term benefits, like as you can see, relief of vasomotor symptom. When we talk about vasomotor, it's more about night sweats, poor sleep, you're feeling low, anxious, and these symptoms can improve quite quickly once treatment is initiated. Usually, I think even 2 or 4 weeks time, some people start feeling much better. Sorry about that. Many women also notice that they started having more energy, they can better focus and start to feel more themselves again. And that's what I hear most of the time. Oh, doctor, I'm feeling more in myself. Otherwise, my mood was so off, I'm not feeling better. It can also help, as we talked in the previous slide, with vaginal dryness and discomfort, which can make a big difference to day-to-day comfort and also relationships. One area which we don't talk much about is a brain health, and some women experiences brain fog, cognitive impairment. They were doing something, wanting to present in the workplace, and suddenly they did not know, the words are not coming up. They find more forgetfulness and difficulty concentrating during menopause. HRT can improve clarity, focus, especially when started earlier. It definitely, lots of women at around this perimenopause, menopause comes and complains about feeling anxious, low mood. It is not new for them. They feel more irritated, agitated, getting upset for everything. And some doctors start them on an antidepressant medication, but actually HRT can help that as well. So, and we also talk about a long-term benefit, which I'm really keen on. They can protect the bone health, reduces the risk of osteoporosis and fracture. We see a lot of women in the age of 55 to 60, they had fractures. So if you started HRT earlier, definitely it's really going to help in your bone. It also supports heart health when it started early in the right time. So overall, it's helping you. A lot of metabolic benefits as well. Diabetes is affect your insulin resistance, so it make it more insulin sensitive, and that helps in diabetic as well. So overall, it's just about feeling better in all your symptoms. But some people find it that they only feel better in few and they don't feel it better in all the symptoms. They might be needing a change in dose or different preparation. But some people might come back and say that's not for them. So you have to, if there's no contraindication or there's no reason why you cannot take it, you should give a try and see where you fit in. But most of my patients, I see menopause on a day-to-day basis, and they have come back and says it's a life-changing event. When we talk of the benefit, it is really important to touch base about the risk as well. Nothing comes without risk, unfortunately. But this is a part that worries women a lot. And this is where my consultation usually people want us to start with and say they have heard a lot about it and they wanted to know what is a benefit, what are the risks, and should they take or shouldn't they not take. I think it is very important to talk about the risks very openly. The reassuring thing is that some of the risks which I look in the screen are short-term, and they are very temporary and tend to settle within first few weeks to months as your body get adjust, which are breast tenderness, nausea, bloating, headache, mood changes, breakthrough or unscheduled bleeding in first few months, skin irritation. Because if you are being given a patch or gel, skin might not like it. So we can change it up. Breakthrough unscheduled bleeding and first few months is okay. We sometimes change the preparation. That should help and stop the bleeding. But if it continued, I would say please seek help because this is something we should not ignore. Now, there are other risks which is always worry to people are about the cancer risk, breast cancer. That's always people want to talk about it. Risks are there, but I have to say the risks are small and it all depends on the individual as well. There can be a small increased risk for breast cancer with certain type of HRT, especially when it's used for long term. You have to always remember that there's an independent risk factor for the breast cancer as well. So if you are overweight, if you are taking alcohol on a regular basis, that produces to more risk to becoming a breast cancer as well. So you carries your own independent risk factors. There's also a risk of a blood clot, mainly with the tablet form, but this is much lower with the patches or gel. So if you ever have the history of blood clot, I will say do not even go for the oral tablets. Stroke risk is again more linked to the age and overall health rather than HRT alone. Again, if there's a stroke risk, I'll go for transdermal preparation. Endometrial cancer, what it means is like a womb cancer. It is usually safe, but if somebody has a womb and they're only taking estrogen only preparation, then you're putting a risk to get the womb cancer because progesterone is given along with to cover the lining of the womb. So if you have womb in, you have to take estrogen and progesterone, please. If you don't have a womb, you can only take estrogen. Always remember that. Now, this is a question I often asked in my clinic. Is HRT safe for me? And honest answer is, I don't know. It depends on you. There isn't a single yes and no for everyone, unfortunately. We look at overall health, your symptoms, your age, your personal risk factor before making that decision. For many women, especially those under 60 or within few years of menopause, HRT is considered safe and very effective. But what matters most is choosing the right type, the right dose, and the right way of taking it. And that's why this should always be a shared decision between you and your own doctor, whoever is looking after you. Once you are on HRT, definitely get regular review. Don't just start taking by your own and continue by your own. it might need adjustments as we go further on, and make sure it is continues to be the right choices, because suddenly if you develop some diseases, some conditions changes, some lifestyle changes, we might have to change the medication, we might have to change the preparation. So instead of asking, is HRT is safe as a general question, I say it's better to ask, is HRT safe and suitable for me? And that's something we can work out together. Now, I'm not going to touch on a great detail, but I'll touch very briefly saying that there are other options available for managing menopause symptoms. These include lifestyle changes like improving diet, exercise, sleep, and reducing stress. There are also non-hormonal medication and therapies that can help, as well as approaches like CBT, we call cognitive behavior therapy. Some women also explore hormone and natural options. However, the evidence for these can vary. I won't go in details of this today, as this could be a full session on its own. Okay, but I wanted to show the slide just to make sure you understand that if HRT is not the only option, there can always some alternative we can discuss and what is right for you. So something is available for everyone.